We all know that swallowing is comprised of three phases. While this is for the purpose of simplification of the act of swallowing, the oral preparatory phase and the oral transport phase, which is combined as the oral phase, the pharyngeal phase, and the esophageal phase. Now, dysphagia can occur or afflict any of these phases of swallowing. Now, when a person does suffer from dysphagia, it's sort of tempting to go ahead and just put in an endoscope or do a video fluoroscopy and see. However, we must remember that non-instrumental evaluation of dysphagia is a very significant part of the evaluation. A non-instrumental evaluation primarily comprises of noting the patient's vigilance, awareness levels, the patient's cough quality, the patient's swallow quality, the patient's voice and cough quality after the patient has taken a swallow. All of these comprise a non-instrumental evaluation. However, that's a discussion for another day. Today we are here to primarily discuss instrumental evaluation of dysphagia. And instrumental evaluation of dysphagia is primarily either endoscopy or video fluoroscopy. Now I would like, my first question to the audience is, what would you like me to talk on more, endoscopy or video fluoroscopy? I'll be talking on both, but I'll elaborate on whatever you want a little more. Endoscopy or video fluoroscopy? Both. All right. Okay, fine. Then I'll just quickly go through the parts of video fluoroscopy, and endoscopy I'll be a little more elaborate. Now, the goals of either of these instrumental evaluations are pretty straightforward. One is to establish whether there is swallowing impairment, whether there is dysphagia. The second is to see the type of dysphagia, which phase it is affecting, what sort of dysphagia does the patient have, and finally the severity of it. Then is to see whether the patient's efficiency as well as the safety of swallowing has been compromised. If yes, see what is the effect of any interventions that we choose to introduce. Also develop some sort of interventions that will benefit the patient on a long term. And finally, make a nutritional plan for the patient. This does not necessarily mean making a nutrition chart for the patient. We are not nutritionists and we won't be able to do it. But at least to ensure what sort of consistencies the patient can have, to what extent, in how much boluses. These are important. So coming on to video fluoroscopy, while we know the indications is dysphagia in any of the phases of swallowing, two contraindications for video fluoroscopy, or at least barium sulfate video fluoroscopy, are suspected pharyngeal leak and when you suspect or know that there's a tracheoesophageal fistula. In these conditions, it's better to use a non-ionic water-soluble contrast medium rather than your routine barium sulfate. Now starting off with the oral phase and seeing what a video fluoroscopy entails. What are the physiological parameters that need to be measured on a video fluoroscopy are the labial seal, tongue control, the movement of the bolus from the tongue into the pharynx, the tongue to palatal seal, and the bolus transport. Oral residues is not a physiological parameter. Now, this first video will tell us how a labial seal, watch this. This here is the labial seal, the lip closing together. You may not be able to make it out very well because the teeth are coming in the way, but then that's the labial seal. Also at the same time, watch the tongue movements. Now, what is important out here? What's important out here is to see the oral transit time, which effectively means from the initiation of tongue movement to the point wherein the head of the bolus crosses the inferior quarter of the mandible. It's called the BPM, the bolus past mandible. This time duration is important. Also, what's important is to see that post-swallow or post-oral swallow, whether there's any residues or barium still remaining in the oral cavity. These are the two parameters that need to be evaluated very well. Also, another thing that needs to be seen is the glossopalatal seal. Now, mind you, this here is the soft palate. This coated thing is the tongue. What we need to see is whether the tongue, or rather the base of the tongue, is coming in contact with the soft palate. Watch this here.